our panelists. Let's see also how the coronavirus is affecting the global economy, which is a bunch of stories that we've prepared for you, and we shall discuss this with our panelists. Now, IMF Chief Kristalina Georgieva has called for an all-out, no-regrets response to the new coronavirus epidemic, which poses a serious threat to the global economy. She is warning that the impact of a COVID-19 outbreak will slow, I should say, growth in the world economy to below the 2.9% posted last year. The virus has shuttered factories, disrupted travel, infected over 93,000 people worldwide, and killed more than 3,200, mainly in China. While some countries are struggling to test for and contain the spread of the illness, that has spurred global policymakers to come out in force to mitigate the damage, including an emergency half-point cut in interest rates by the Federal Reserve on Tuesday, followed by a similar cut by Bank of Canada on Wednesday. While some economists argue lower interest rates will do little to help address interruptions in the supply chains, Federal Reserve Chair Jerome Powell said it will provide a boost to confidence.
Thank you very much.
And let's listen in to some of the reactions. And while also Georgieva said the global financial system is in good shape now after being fortified in the wake of 2008 crisis, we do need to have measures that are bringing a sense of confidence and prevent credit from freezing up. The IMF in January forecast growth this year of 3.3%, which means at least half point will be lost to the virus. Georgieva said the fund's analysis had assumed the virus will largely be confined to China, which will have led to a sharp burst, short economic slowdown followed by a quick recovery. The fund is due to release its updated forecast in mid-April. Georgieva and World Bank President David Malpass spoke to reporters after a conference call of finance officials from members nations who directed the IMF to use all its available financing instruments to help member countries in need.
What we are wrestling with is uncertainty, and that defines our projections, which at this point lead us to state that global growth in 2020 will dip below its last year's levels, but how far it will fall and how long the impact would be is still difficult to predict. This is no longer a regional issue. It is a global problem calling for a global response.
We want to really find ways to supplement and augment the availability of working capital, which is the capital companies need to import goods, to rebuild their inventories. So it's the short-term financing that's critical during a crisis.
And Chinese doctors currently working in Wuhan, they say the novel coronavirus can easily invade the organs and is really a threat to human beings. Cao Beans and others were speaking to journalists via a video link briefing organized by China's State Council.
It seems that the SARS-CoV-2 virus can easily invade the lung, easily invade the other organs, including the heart, including the liver, intestine. So this new virus is really a threat to human beings.
All right, and those doctors, or is a doctor from Wuhan, I had other clips as well. We'll play them by you much later in the course of the program. We want to buckle down to discuss this with our panelists. Remember, the subject is coronavirus and the global economy, or the economy, how it is also affecting us here in the country as well. We'll give you more details also on what is on the front page of the East African as well. Imports also have really slammed as far as, you know, the ships that dock at Mombasa Port is concerned. So we have a panelist with us, and we begin with Dr. Geturo Wanaina, good morning.
Morning.
Yes, so we've heard also from the doctor there from Wuhan. Now it is a big threat. Your current assessment, briefly.
Now, let me first step back and Keep is asking me we should be having masks here.
We should be having masks.
Yes.
But I thought you saw also the sanitizers are around.
And also greeting with our legs, you know. But I think we can't underestimate the impact of it. I think it's one virus which perhaps has affected every part of the world.
Yes.
Whether you look South America, whether you look Europe, Africa. And as I said earlier on, the start of this show, it's probably one of the key things is how do we solve this humanitarian challenge? I think that's really affecting everybody. There was a very interesting clip from Singapore. And I think it's time as countries look at this, how much hope do we provide? How much are we dealing with it? And Singapore, I think, is one country which has come very strongly in terms of addressing it. And the question here is, as one, we can deal with it as a country, as the nations of the world. So my thinking about it, yes, it has and it will indeed. Particularly if you look at our small businesses, which get a lot of their products from China, that really has impacted on them. One issue comes is also look at hotels. For example, the flights which have been cancelled from Italy, this basically the chartered ones.
Yes.
It means they are not coming to the hotels. So what does it mean in terms of the people working in the hotels? So it's something perhaps, and I'm happy that institutions like IMF, World Bank are coming in and how we deal with it. But I want probably to emphasize the point probably we need to deal with. I think right now it's not blaming. Yesterday we saw what was happening in Nairobi. It's not a question of blaming. It's a question of how to deal with it. And we are very good at blaming than saying this is probably how we can deal with it. And I think each one of us has a responsibility. Because I think it's one area we can manage by simple ways. I'm happy also to report that the last victim of Ebola was released on Tuesday. So as far as Congo is concerned, that has been contained. And I think we can contain this with the efforts we have right now. Worrying, actually, yesterday, the governor of California declared a state of emergency because of this. So there are certain things we need to take. We all know that in Rome, schools, universities have been closed for almost a month or so. So there are certain things we need to take so that it really doesn't permeate as much as possible in Africa. The case in Senegal, the case in Nigeria, at least they have recovered, and therefore they are positive coming. If you look at in terms of the people affected and people dying, it's decreasing. Really, it's decreasing, and that shows you exactly that there are some efforts. And I think this is where the international community comes to support even developing countries like us in terms of dealing with it.
Right.
Yeah.
Right. Let's hear from Dr. Collins Odote. Good morning.
Good morning, Debal. We were here last week.
Yes.
And last week, I remember some colleagues on this show saying that, this is not such a big thing. And I think that was also in the context of the kind of response that we were seeing from government. I am happy that a week later, both our views and in her words, the economy will fall. She just doesn't know how far, and she doesn't know how long the impact will fall. Last week, Debal, I was scheduled to go to, one of the newspaper articles says, the greatest spread of this is going to be travel and the hospitality industry. How we monitor that process and how we deal with the unnecessary travel, I think is going to be a critical issue. The second thing is what amount of preventive measures that we put in place. Last week as we were here, I think there's a huge concern about what government was doing. A week later, it's extremely exciting to watch what government is doing. I think our good friend, C.S. Mutaika, I think could not have gone to that minister at a better time. An excellent communicator and somebody who reassures you when you're watching. So looking at the kind of communication he's giving, I think that's the kind of thing government should have done much earlier, but should continue doing consistent, because there's a lot of misinformation fast going on. There's a lot of helplessness. You've just heard Gituro saying that wear masks. Yet 2 days ago, I was watching some clip where somebody was saying that those masks actually don't help, and was making a medical argument. As a normal Kenyan, I don't know who of those two to believe. But if we get consistent information, we would know what to do. The third thing, the ban that is critical, Kenya is a travel hub. How we ensure that we limit the possibilities of that disease coming to Kenya is going to be important. But two, if it does, how we deal with it is going to be extremely critical, because I think the levels of preparedness, even as of today, is not where it should be. You've heard, for example, countries saying, we are locking down cities, we are locking down schools. And I woke up and asked myself, I think we're discussing with my class, what happened, but if they said today, Nairobi is on lockdown? What will that mean for you and I in terms of our daily operations? Are we mentally prepared for it? Are we as a government prepared for that kind of a job? Because I think a lot of us are still behaving as if this is something that we're reading in the papers and that is happening somewhere else. It can't happen here, and I think we need to enhance the levels of preparedness and the levels of response. But the initial actions that the government has taken this week, I think it's reassuring. It's also it's also nice to see that Parliament is allocating monies for this from around July, the next budget. I was happy to see that happen, but I think that I also asked myself, you know, between now and July is a long time away. So we should be talking about also the amounts of resources that we are setting aside to deal with the emergency between now and July.
All right, thank you. Kittony.
Thank you very much, Debal. First of all, I'd like to, take the opportunity to appreciate President Kenyatta for his recent appointment of Mutahi Kagwe as the new CS for Health, and to also congratulate my friend Mutahi Kagwe. And like Mr. Odote, I agree that he's a highly proactive, highly respected leader, and I'm sure that he will come into this ministry at a time that the country really needs that kind of leader. Let me say, I think we need to look at this thing from the context of the globe and the context of Africa before we even look at our own country and the counties. We don't know whether it is a fluke, whether it is insufficient capability on detection, or just simply luck that we have such a low incidence of coronavirus in Africa today. I think there are only about 3 or 4 countries. I think yesterday evening we saw that Senegal has joined the list of countries that has got victims of coronavirus. But I want to say that, one of the resolutions that I took at the beginning of this year is that I will attend church every Sunday. And, reading through the Bible, and looking at the challenges that we are faced with today, particularly coronavirus and even the Locust invasion, I think we are facing challenges of almost biblical proportion.
In the last days.
There's a keep I don't know.
And
go on.
There's a time for everything in the book of Ecclesiastes.
Yes.
So the thing is, we really need to concentrate and really be focused on this matter of coronavirus. And I think that it's a big challenge for countries that have got poor healthcare systems. Many countries in Africa have got poor healthcare systems. We don't know what will happen if we have an epidemic of coronavirus in Kenya. But I want to say also that the government seems to be taking it seriously. We've seen the initiatives they've taken. We have an isolation ward at the Bagathi Hospital. We've seen the Council of Governors convene a meeting to have a conversation around what to do in the event of the outbreak of coronavirus. We've also seen the government reach out to those students that are in Wuhan, in China, and even extend funding to them. And of course, there are still questions out there, and the jury is still out about whether it was the right decision or not to allow the China airplane to land in Nairobi at a time such as this. But suffice it to say that, I have a strong faith in the global scientific and healthcare industry, and I'm sure that somewhere in the world, somebody is working very hard around the clock to ensure that we have some sort of remedy, some sort of cure, some sort of immunization regime to protect us from coronavirus. Because at this point in time, I think really we can only count on Lady Luck.
All right.
Yeah.
All right. Let's also hear from Robert Shaw. Good morning.
Good morning. At the beginning of this year, as many of us do, I looked at the prospects for the economy in particular for Kenya, and was relatively optimistic. I say relatively because, like with all these things, there's a caveat. And I think somewhere in my wording I said, all things being equal, but of course, the tourism was doing quite well, we'd had reasonable rains, etc., etc. But there's always a rogue factor, and I think what we're seeing now is the rogue factor. I mean, there's two at the moment, and it could really impact our economic growth. Coronavirus is obviously one, and the Locust is another. Coronavirus, I think you've got to look at it in a very rounded way. It's got many effects. It's affecting a lot of businesses here. We all know that a lot of imports come from China. You can't really go round your house without seeing several items that have come from China. I was somewhere the other day and I said to the person, do you have enough chlorine for the swimming pool? And they said, gosh, I hadn't thought of that. And there was already a shortage. So there are shortages of a lot of items. And then it's going to affect our tourism. People are already less in the mood for traveling. And countries that are affected, particularly like Italy, are, European countries, travel is reducing. Mm-hmm. So it is going to affect it. And as you know, tourism is one of our biggest earners. So generally, in the economy here, we're going to see a slowdown. By how much, it's difficult to say at this stage, but if you put the factor in the Locust, you're talking about two fairly big hits on it. Now, what could really hit us is if it literally hits us here. And what we've seen is that coronavirus does have a knack of spreading quite quickly. And yes, we have acted fast here, and credit should be given to that. But if it spreads fast, if it comes, we don't even know now. Honestly, none of us could actually honestly say there are no cases here. We would like to think there aren't. Officially, we're told there's none. But we just don't know, because the symptoms are symptoms that, are quite common in a number of other things. So, can we cope? If it hit us, I think we could be very, very tightly stretched. Remember, our medical, our health service, our public health service, for the majority of the people, is already very, very stretched. Medicines are hardly available. You quite often go, you will be told to get this and that, but it's not available, and you will have to go out and privately buy it. So you're going to see all sorts of things happening if that took place. So I'm hoping we're not going to be that affected, but I think we need to be. We need to look at the darker side of this and say, well, what happens if it hits us, and not just hits us in Nairobi, upcountry? Could we cope? Yes, in Bagathi, that's fine. But what about, Eldoret, Kisumu, etc.? So I think we've got to be very aware that this could spread. It is pretty contagious. And that would be another very brutal hit on the whole of the economy, as well as on the social, everything basically in the country.
Right. Do you think maybe we are really slow off the mark as far as also making sure that the social interventions or social distancing measures are taken? Because other governments that have done so, we understand in Uganda right now you're not supposed to actually to hold any public rallies as it is, or public gatherings. They've actually banned that for now. Tanzania also is advising people not to, also appear in a public gathering. We know South Korea, also the government has invoked the power to forcibly stop any public activities such as mass protests, schools, airports and military bases are closed. Italy said also on Tuesday it could close all schools and universities for 2 weeks across the country, where more than 2,500 people are infected and 79 are dead. That is the highest number so far in Europe. I know in the United States now it has risen to 11 from 9, which was yesterday. And also Italy is mulling over to ban kissing as well. and handshakes to limit the virus spread as well. So social distancing measure, how should we fare, especially in light of the BBI rallies that we do have right now?
Let me just weigh in on that. Firstly, to say that the effect on the economy is cannot be gainsaid. I mean, if we look at the reality, I think no measures should be, nothing should be left, and no stone should be left unturned insofar as trying to deal with the potential of an epidemic of coronavirus. And like Mr. Shaw said, I mean, the pathogen of coronavirus actually is such that the symptoms are very difficult to detect. So it is actually very difficult to us to tell if for certain we actually have no infections. But if we look today, I mean, very many global conferences are being cancelled. I mean, recently we had the GSM conference in Barcelona, which is one of the largest exhibitions for the telecommunications industry, cancelled. Closer to home, we have the Great Lakes Private Sector Forum in Kigali 3 weeks from now that has been postponed indefinitely. And I think that it's a very responsible thing to actually reduce the number of public gatherings. And like I also share the view that the impact on the travel industry, particularly on airlines, many airlines across the globe are tottering on the verge of bankruptcy. And your guess is as good as mine about what the impact will be to the airline industry globally. And we know, including our own national airlines, Kenya Airways, South African Airways, literally on the verge of bankruptcy. So, I mean, it will have serious effect and consequences because we have a lot of hotel groups also investing in infrastructure in Kenya and in many other parts of Africa. But also, let me just say that for me, nothing should be left unconsidered. I mean, the social distancing should be a major aspect of the attempt to prevent ourselves from getting coronavirus. And I'll close by just saying it's very disconcerting to see the political class continue to clamor around the BBI like it is something, this reggae, can it be stopped or can it not be stopped? I think to me, frankly, the coronavirus and the locusts are more important. And there's other ways, that we can mobilize public participation around the BBI initiative.
Right. So do you think also we should go with the social distancing measures?
I completely ascribe to that, yes. And next time you invite us, please have a mask for us.
For you now, you seem like you're gagged. How will we even hear your voices?
Because the advantage of that is that you can pass on some of the more intelligent contributions, apart from Mr. Shaw's, your own.
Because it's preventive. I think that's the point we're making. And when you have something which is preventive, I don't think you can go to the shops and buy anything about it. So it's just preventive. And I think what we need to do is preventive. And it's worrying at this stage when you still, and I think Kip, I agree with you, when you still have these mass gatherings. I think that's something we should come out very clearly. That worrying thing, and we are neighbors, is Ethiopian Airlines are still making trips to those areas. That's open for us, because it's easier for me even to go by road from Ethiopia. It's easier to take ET to Nairobi. So there are certain things we need to take concerted efforts. Because the whole problem with this is, and I'm sharing earlier on, these guys are literally greeting with their legs, is how serious it is. I had dinner with somebody from China on Monday, and he's telling me, he's a student here, he's telling the mother hasn't gone out for almost a month out of the house. So is that serious? And I think we need to take to another level. BBI can take another backseat, and we deal with this, what we have. It's just preventive than anything else. So I agree with you. There are certain things we can deal with. Kissing can hold until perhaps sometimes bad, all those kind of things. But I think it's more of personal hygiene. I had the opportunity to travel on Friday to Tanzania. And for once I became very conscious what was surrounding me. It was interesting when at the airport we had some Chinese and they could see everybody look at them suspiciously, which perhaps is not the reason. But I think we need to take certain steps which would help us to deal with it. The good thing is it's preventive.
It is preventive. Right.